Welcome to the latest DiabetoShorts podcast, brought to you by MedSynapse. DiabetoShorts is a weekly program covering a wide range of clinical and scientific medical content that offers enriching insights into the world of diabetology. In today's podcast episode, we will discuss the clinicopathological and laboratory data to propose potential diabetes-linked novel neo-vulnerabilities that can reshape the olfactory mucosal immune landscape during airway infections such as COVID-19 and COVID-19-associated mucormycosis. The original research is published in the March 2022 issue of Diabetology. Current outbreaks of COVID-19-associated mucormycosis leading to diabetes infections have increased, which has led to a new challenge for patient management. The estimated number of global cases of mucormycosis per year pre-COVID era was 10,000 and it rose to 47,000 after COVID-19 pandemic started. During the COVID-19 pandemic, systemic corticosteroids were administered in large amounts to circumvent oxygen desaturation, which eventually lead to the occurrence of mucormycosis associated with diabetes. There has been a recent surge of mucormycosis with COVID-19 infection, particularly in patients with diabetes. Accordingly, an important area of research in COVID-19 therapeutics is engaged with identifying diabetes-associated pan-cellular stressors. A novel in vitro virus-free model of COVID-19 was designed to investigate the effect of serine protease potential cellular stressor on disease component monocytic cell line that could help in estimating the COVID-19-associated pathways. The results showed that the monocytic cell line has upregulated COVID-19-associated pathological pathways. The upregulation included co-segregated with complement coagulation, olfactory transduction, steroid biosynthesis, iron-iron binding, ferroptosis, and maturity-onset diabetes. This study was conducted to understand the immune deregulation during COVID-19 and COVID-19-associated mucormycosis. To conclude this study, it was observed that diabetes, being the most common metabolic disorder, is an independent risk factor for severe COVID-19 and mucormycosis. Patients with diabetes, affected with COVID-19, and superinfection with mucormycosis have to face an adverse clinical outcome and will have a prolonged stay in the hospital. This ends today's podcast, brought to you by MedSynapse. Thank you for listening.